That's a lack of love.
Alrighty. So, what are we doing with you today?
Oh man, I'm cancer free.
Dr. Schleinen saw you.
Yeah.
Yeah, I'm cancer free.
Mm-hmm.
Praise God.
Yeah.
I've got to get my knees and my hips taken care of.
GI. Science.
Yeah. See, you wrote me one out before.
We got knees and we got hips.
Yeah, my knees and hips. Yeah, especially this one. This one just crumbles when I'm walking.
The left one.
Well, yeah, but they're both bad.
But that one's really
So
bad.
who's going to do that surgery?
You're going to have to... See, you filled one out before, but you made it for my lower leg, my lower leg, so they wouldn't accept it. So
Which is your favorite GI guy?
I have no GI guy, do I? What's a GI guy?
Well, no, I mean, I'm the orthopedic guy.
I don't know.
Galt,
I saw
Versteeg.
Galt sounds familiar.
Galt is familiar.
Galt, Versteeg.
But was he the good one or was he the mean one? See, I know something's happening because I'm falling down. Plus, I'm waking up at night and I'm having so much pain.
What about
in my
Sullivan?
leg.
That's a neurologist.
That's my neurologist.
Yeah. What about... Who's your pain person?
I don't go to them no more.
Okay.
I haven't taken a pain pill for
Praise the
years.
Lord. Praise the Lord.
You know.
Okay, so what we got to do? Hold still. Let me get this all updated here.
Okay. I need all my prescriptions refilled. Need them all redone.
Okay, so we're not on any tramadol.
We're on tramadol. And that's it. And that's for my headaches.
But who do you get that from?
You?
Okay. Now hold still.
Okay. I take my tramadol, I take my anxiety medication, my Valium, and my muscle relaxers.
What about the Effexor?
Those are happy pills?
Yeah.
I don't take those.
Effexor.
Yeah.
Okay, no Effexor.
I've got 3 bottles of them at home. They don't do nothing for me.
So, the other, 2 things, here's where the situation we're going to have in the next 3-4 months here is the use your Valium. How much are you using that now?
You got me cut down to just 60 a month. That's
But you're on 10 milligrams.
Yeah, but...
She was taking 90.
Yeah, I was taking 90. If I could have... I need something for anxiety. I have really bad anxiety.
Especially when she needs something.
Too many people have left me.
Here's what I'm trying to tell you. On your Soma, how many of those are you using?
I take maybe 1 to 2. I take them as needed.
A day?
Huh?
A day?
A day, yeah.
Okay. So what I'm trying to tell you is, there's your Soma.
Uh-huh.
Okay.
But it's not enough for the muscles and the actual pain that is going on in my legs.
Right, and here's what I'm trying to let you know about in a nice way, is that the levels of those are probably going to be going down, not up. Okay? And I'll try to explain that to you. Hold still a minute here. Let me get you. Here's your Soma.
Yeah.
Okay, so I got it done. Okay?
Yeah, I'm supposed to take 1 tablet 3 times a day. Sometimes I have to take 2. And sometimes I have to take 3.
Okay. What I'm telling you is, I don't know if you follow along what's been going on in the papers and all that stuff, but all of those things, all of this stuff with all of the medicines, in Oregon, there's going to be less pain. There's going to be less anxiety. There's going to be less stress. And they're going to be less of all of those medications. And right now, our issue between now and August is who's going to take, I'm going to refill your medicines from now to then, but who's going to take care of those medicines come this fall?
I got a piece of paper, I have to find another doctor.
Now, couple options, La Clinica,
Yeah.
Community Health, okay?
Okay.
Those would be two options, but again, I think, I don't know if you're following, you know, the pendulum here and stuff. First of all, congratulations for getting off all that pain medicine.
Yeah.
But it wasn't.
Did you understand what I mean? In other words,
It wasn't
It was
easy.
burning.
I don't want to sound like I'm yelling at you, but in the time here that we've got, I want to be firm about, you know, I want you to come to a soft landing this September, okay? And so I think we need to aggressively be looking at how to get to a soft landing.
Well, the pain clinic wants to put me back on hard drugs.
Right. I'm not saying
I don't
going.
want to.
I'm not saying going to them. You know what I mean? I'm saying what we got to do is have a place. Again, like La Clinica, they might say, "Yeah, look, we'll take care of this." You know what I mean? But I don't have anybody here that's going to take care of that.
Yeah. So he's trying to give you options. So
Right. So again, I'm trying to be firm, but not.
Just tell me how it is.
I'm not trying to.
I know, but I'm a
Yeah.
mom and a grandmother
Right.
and a great grandmother.
So
you can
tell
shoot
me,
straight.
I'm trying to
tell
say.
me it from just the fact.
Right.
The fact
So-
of it.
So those are the things we got to look into. Okay. Now, so I got everything refilled here with some refills.
Yeah,
So that'll get.
I'm really comfortable with what I'm doing now
yeah, her
because the
Tramadol,
headache,
her
the
Soma,
tramadol
her
I
Valium.
need monthly, though not every.
yeah. It doesn't make any sense.
No,
Way better written
the
up.
way it's written up doesn't make sense.
Right. But what I'm saying is again, my general theme is that every month here we're going to decrease these medicines because I don't want you to end up having to, all right, you know, we pull into July and you don't
Are
have,
they going to take everybody's medication away? Is that what you're saying?
well, I'm just not going to have you pull up to July and think that these medicines are all going on. So if we're the part of the reason for decreasing the dose a little bit is it motivates you to find plan B. I got several people that I've actually started talking with several people that had a bigger problem than you. I actually started talking with them back November and said, look at November, December, said, look at, I think I see some storm clouds on the horizon. You're going to need to get motivated. And the problem is that until I started decreasing their medication 10%.
Oh, you've taken like.
And hello.
You've like taken 80% of mine away.
You've been really doing good. Now hold still a minute, Joyce. Let me get to the next step here. You're always trying to confuse me.
I know, that's me. Women do that. Where's my coffee?
Right here.
Oh, can I have a drink? But they do want to put me back on that Norco, whatever I was taking. And I won't go for it.
Okay, so now, the big thing I got to get done today
Ouch.
is you need
Yeah, I have a lot of muscle spasms in my back.
ambulatory referral to orthopedics.
Right. Because I don't want to use my wheelchair all the time. And I haven't even got it dusted to put outside this summer so I can take walks.
Okay.
But I can't walk. I can't take walks without.
We got Dr. Galt, Dr. Versteeg,
Who's a good one?
Dr. Clevenger.
You know my personality and you know me.
Now, are you mentioning them in alphabetical order or by order of interest?
I think these would be three.
You know my
who have you
Galt.
seen over there?
Galt.
How'd you do with Galt?
I don't remember.
Yeah, it's been a long time.
Well, that's good though.
I've got 12. I'm working on 12 brain aneurysms.
Now look at. That's good news because you're not remembering something bad.
Right.
Yeah.
There you go.
It's the only my dermatologist I don't like. Because he tells me I've got old age spots. And psoriasis, and it's like, I do not. And the treatment he gave me is, I don't know. The cream is uncomfortable on my skin. I'm a fancy girl. I'm a pretty girl. I'm a girly girl. When I go somewhere, I really dress. I'm just a girly girl. But I want to go to your retirement party.
I think it's going to be a small retirement party. Small retirement party.
Yeah, they said you can have
it.
They said you might as well have it at your house. That's how small it's going to be.
I've had 35 wonderful years.
It's a long time.
Yeah, and your wife has dealt with you through all these years.
More than 40 years.
Then, yeah.
See, so that's a pretty good deal.
How old are your kids now?
30. Okay, so most of the stuff in your belly is doing better now?
We're trying. We're working on it.
The acid problem, she's...
He wants me to take Prilosec for the rest of my life.
Sure, Linus.
Yes.
He's a wonderful guy.
He's so he's colorful. He's like me, and we get along just fine. He's so colorful.
The last time I did blood work on you was 1 year ago.
No, we've done blood work since then.
May 14th of 13. That's
really
essentially 1 year ago.
Because
no,
I've had
I'm sure you may have had blood drawn elsewhere, honey.
Yeah. So the only thing else we've done is when you had that urinary tract infection for Christmas.
Right.
Oh yeah, that's going to be an ongoing thing.
So what I'm saying is, so has somebody else checked your blood?
Yeah, we did.
Yeah,
I just had my procedure. Dr. Schleitz just went through my blood work.
Yeah.
Oh yeah, I just had extensive blood work done with Schleitz.
But that was all GI blood work.
Right.
He didn't check your thyroid or your diabetes or any of that stuff.
But yes, he did. And the levels came up good. Yes, he did. Yes, he did. Because my sugar level, my thyroids, he went through it with me step by step, and all of them are good.
All right.
Even my cholesterol is not that high.
All right, so...
Because, we did.
Okay, I know, I believe
I've had 3 different kinds of colored bandages on my arm, so that's brand new. I know those are brand new. And I've got 3 colors of them. I got 2 of them here.
Okay, so I'm sending you to Galt, making a referral to Galt regarding osteoarthritis of your lower extremities and hips and stuff.
Well,
You're back too?
Well, it's my brain doing it, Doctor. Or Alan, call you Alan. It's my knees, and I do have muscle spasms when I'm short, so I strain myself all the time, reaching and pulling at things. Paul put in, he's going to be my caregiver. I'm just getting to that age where my body's breaking down.
Did we do that back in December? We did this back in December. The computer's telling me I'm doing a duplicate.
Yeah, we did do it.
Yeah, but you did it for the wrong part of the body.
Right. You did it for the wrong part of the body.
Okay. Well, I redid it.
And I had to go through the thing with shyness before I could think about my knees.
Okay. So I redid it for you.
Okay.
Okay? Right now, hold still a minute. Now, let me print this out. Okay, so I don't need to do any blood work on you. Okay,
I don't think
so your heart's doing good. Remember,
everything.
Let's focus on number 1 reason you're going to die is what?
My brain
heart
aneurysms.
attack. Number 2 reason you're going to die is?
My aneurysm.
Your aneurysm. Number 3 reason you're going to die, but you just got a lease on that, would be your colon cancer. Mm-hmm. Number 4 reason you're going to die is your breasts. How we doing there?
They've been removed, so I think they're...
No lumps, no bumps, no stuff.
No.
Okay, so hold still.
No.